Hello, my name is Kanisa Gardner, and I'm going to be the nurse for today. I will come in, introduce myself, verify my patient, provide privacy, wash my hands, and put on gloves. Today, we're going to be doing a postpartum assessment. First, I'm going to just take a look at the breasts. I'm going to see if they've become heavier and fuller and see if they feel nodular and firm. Sorry. Which they do. I'm also assessing for any signs of infection, such as pain, redness, or warm. They weren't red. Did you feel any pain? And they also weren't warm. I would ask if she's having any problems with latching when it comes to breastfeeding the baby. And I'm also going to palpate the breast for any tenderness. So now, when I did palpate it, she didn't have any complaints of tenderness. She said it feels fine. There are not any lumps or masses and no bruising. It's soft and both of them are round, which is the normal limits. Next, I'm going to go down and assess the uterus. I'm going to palpate the uterus to see if the uterus is firm and make sure it's contracting to prevent any postpartum hemorrhage or a lot of bleeding. Which is not bulging. It feels firm and it is contracting. It's not feeling boggy. And if it was a little boggy, I would just massage it. Going down to feel the bladder, and if the bladder was moved more to one side of the body than right in the middle, it would mean that she has a bladder distension going on, which it is not. I'm going to make sure she's urinating. Just ask her, have you been urinating? How often? What color is it? Ask her if she's having trouble urinating. And I will also ask if there was any pain, burning, or tingling upon urination. Next, I'm going to go to her bowels. I will ask, when is your last bowel movement? Is there any pain during your bowel movements? Any odd colors besides green, brown, and black, and any blood present in the bowels. Now I'm going to also go ahead and listen to my bowel sounds to make sure I can hear them in all four regions. And they are all heard in each quadrant. Stomach is smooth. Skin on stomach is one color. Next, I will go ahead and go to her lochia. I'm going to assess for the color amount and any odor that may be present. Should be bright red and only last for a few weeks. If there were any abnormalities, I would let the doctor know. And next is the episiotomy. I would ask if there was any tearing during birth. I will assess for any redness, edema, ecchymosis, and discharge and report the findings to the HCP. I'm going to assess for edema in her legs, which she doesn't have any edema. When I push my finger and run my finger across, there's no indentions in it. All right, and that is about it. Thank you. And also, I'm sorry, on her extremities, there wasn't any redness, warmth, or edema. And I will also ask how is she feeling after giving birth? How is she feeling mentally, and any concerns that she may have with me? Sit down, talk to her, educate her on any questions that she have. Thank you.